Reestablishing trust is the main focus of a new 100-day plan at the Tomah VA.
The acting medical center director says that regaining that trust following the investigation into overprescribing opiates and a retaliatory work environment is needed both inside and outside the facility. New at 10, News 8's Kyle Dimke is live in our newsroom with more.
Well, tonight the Tomah VA leadership hosted a town hall style meeting in La Crosse to discuss anything or answer any questions veterans, their families, or the community may have. Now, the turnout was minimal, so the VA discussed some changes taking place, that 100-day plan you mentioned, and changes to the Veterans Choice Program, which allows veterans to receive care outside of the VA system. Nearly 13 months after it began, the U.S. Department of Veterans Affairs announced after hearing from stakeholders, changes are being made to the Veterans Choice Program.
It's feedback coming from within the VA, it's feedback coming from the veterans, it's feedback coming from the private partners that are providing the care through choice.
The Choice Program allows veterans to receive health care within their community instead of at a VA facility, but still using their VA benefits. The biggest changes include removing the August 1st, 2014 enrollment deadline to access the Choice Program, and if the VA cannot schedule a veteran's appointment within 30 days of the date a physician determines they need to be seen or a veteran wants to be seen, that veteran becomes eligible for the Choice Program.
It's realistically trying to simplify the process.
A change specific to the Tomah VA is the announcement of its 100-day plan. VA staff says this plan capitalizes on the success of the hospital's previous 30-day plan, focused on moving the Tomah VA forward after allegations of overprescribing medication and a retaliatory work environment surfaced in January. The 100-day plan outlines steps for improving access to care for veterans, improving employee engagement, and restoring trust both inside and out of the VA, which the acting medical center director says is extremely important.
On a scale of 1 to 10, 10. If you don't have trust, and people do not believe that the care they're receiving, they don't trust in the care and they don't trust in the people delivering that care, then why would you come?
Now, the medical center director says the Tomah VA is building that trust through more listening sessions with staff and veterans, creating ways to anonymously report concerns, and opening an employee wellness center. The director says leadership is also becoming more visible on all shifts in the hospital, and her door is always open for concerns from both employees and veterans.
Thanks, Kyle. Now, in terms of improving access to care for veterans, the Tomah VA will be recruiting additional psychiatric staff. Over the past year, staff shortages caused psych units to close and cuts to its urgent care hours.